External nose, what we can see on the surface. External nose, when we see, it's like a pyramid. It's the pyramidal structure. Here is this A part is the base. The thing that is the upper end. Here is the upper end. This triangle on the lower end is the base. In the base, there are openings of the two nasal apertures, the nostrils, the nares. And between the two, the column of skin that is present at the lower aspect that is known as columella. It's a part of the nasal septum. It's the skinny tag that is present. You can actually move it around. If you just pick it up, you can move it around like this. This tag of skin that is present between the tip and the base and this base of the nose is known as the columella. Then this is the dorsum of the nose. This whole area, especially the bony component, this is called the bridge. And where this dorsum meets the forehead, this is called the root. And if you follow the dorsum all the way to the apex, this is called tip or apex. This later expansion of the base that is known as ala. If we look at the skull, we will see the nasal aperture. It is very present deep out inside the what we can see on the external nose. So this picture is with the cartilage is removed. So this bony landmark, the bony framework, it includes the two nasal bones on the top. They join in the midline with the internasal suture. The two maxillary bones on each side. There are maxillary bones on each side. Frontal process of maxilla to be exact, and on the floor the maxillary bones meet at the midline, and the raised thing that is present in the midline that is known as nasal spine and the anterior nasal spine. So these are the structures that are forming the bony framework. Let's add onto the top of that the cartilaginous structures. First, there are two cartilages that are present just below the nasal bones. This cartilage, you can see the boundary right here. This is the lateral nasal cartilage. This is the lateral nasal cartilage, and it is like lateral nasal cartilage. Netter has written is that lateral process of septal cartilage. So this is the lateral cartilage. It is tucked inside the bone above. So this cartilage is going beneath the nasal bones. So it is a little like you tuck your shirt inside, it's tucked beneath the nasal bones above. This is the nasal cartilage. In the anterior end, they have a little distance between them, and then through this distance, you can see this the cartilaginous component of the internasal septum, the septal cartilage, or the cartilaginous component of the internasal septum between them. If you look below, the tip, the columella, and the lower aspect of the septum, the tip, and the ala. This consists of a U-shaped cartilage that is known as major alar cartilage. You can see the the part of it that is on the lateral aspect of the nose that is known as major alar cartilage, and it bends in the midline. And here, this part actually you can see right here. This part is the medial crust of the nasal cartilage. You can see them better here. The part that is outside is the lateral crest, and the part that is on the inside, the two medial crusts, the two medial crura meet in the midline to form the lower part of the columella. So this is the medial cartilage, alar cartilage with its lateral and medial crust. An important thing to know is this cartilage does not go all the way to the ala. The lateralmost part of the ala, here you can see, it is made up of simply fibrofatty tissue covered by skin. We will talk about skin also. I forgot to discuss in the previous slide. So it is the made up of fibrofatty tissue. Apart from that, there are minor cartilages. They are present in a different places. They may be present in the ala, and there is usually a constant one that is present between the lateral and the alar cartilages. So this is whole about the osteocartilaginous framework. Just to talk about the skin, if you can mm, check on your nose, if you place your finger on the root of the nose, you can move the skin against the bone below. If you go to the dorsum, you can move the skin against the bone below. But if you go to the ala, the skin, you can move whole of the ala, including the fibrous fatty skeleton inside, but you cannot move this part independently. So the upper part of the skin, it is thin and mobile, but this part is strongly adherent to the skin below, strongly adherent to the tissue below. And this is the part of the nose, the ala of the nose, that contains a lot of sebaceous glands. And that is why you get lot of blackheads here, because blackheads come from sebaceous glands. So this is the part that is thick and contains a lot of sebaceous glands. So this is what we talked about. And if you take a close-up look, you can actually see the openings of the sebaceous gland where the skin is thick and tightly bound here. Then there are facial muscles that are underlying it. We talked about the transverse nasalis muscle, procerus, dilator of the nostrils, the levator levi, iliac nasi. There are different muscles that are attached to the muscles that are attached to the skin beneath the nasal bone, beneath the nasal skin. If we talk about the sensory nerve supply, it is mostly from the it is mostly from the ophthalmic division of the trigeminal nerve, with a hint of the maxillary division from the lateral aspect. There are three nerves that are important. If we have studied in the orbital cavity that a branch of the nasociliary nerve were exiting the medial aspect of the orbit below the trochlea, the infratrochlear nerve. This is the part of the branch of the nasociliary nerve that itself was the branch of ophthalmic division of the trigeminal nerve that exits the nose and supply the root and bridge of part. This is the part that exits and supplies the root and bridge part. Then there is an external branch of anterior ethmoidal nerve. We discussed the anterior ethmoidal nerve's course in the orbit, in the lecture of the orbit. We will discuss its course in the nose today, inshallah, as we talk about the interior of the nose. It exits, if we look at picture here, it exits between the junction of the nasal bone above with the lateral cartilage below. It exits from there and it supplies the dorsum of the nose all the way to the tip. Then we are left with only one nerve. This is the infraorbital nerve emerging from the infraorbital foramen below the eye, and it is a branch of the maxillary nerve, as it supplies whole of the area in front of the chin bone, cheekbone, from the lower margin of the eyelid to the upper margin of to the upper lip. It supplies the lateral most aspect of the nose also. It supplies the lateral aspect of the nose, including the ala. This is about the sensory supply, and the point to remember is that the infratrochlear and external nasal branches of anterior ethmoidal are from the ophthalmic division of trigeminal nerve. Both of them are branches of nasociliary nerve, and this little aspect, it is from the maxillary division of the trigeminal nerve, infraorbital nerve. When we talk about the arteries, these are most of the arteries you have read about in the arterial supply of the face. Let's just talk about first the branches of the facial artery that are involved in supplying the nose. If you follow the facial artery, there were labial arteries going to the upper and lower lips. Then there was this branch going to the ala, going to the lateral aspect of the nose. This was lateral nasal artery. As we move above, it does give small minute branches, and that's it. That's about it. That's the branches that it gives. That's one branch. And if you follow the superior labial artery, the one that is going to the upper lip, it does give the branches to the nose superiorly. It does give a branch to the lateral aspect of the ala, the the ala, that is the vestibular branch, and it gives branch in the midline that is going to the columella, that is known as columellar branch. So they are going from the facial artery. There is a lateral nasal artery and the arteries that are going from the upper lip supply. Then there is the branch of ophthalmic artery that are important. We did talk about the arteries of the ophthalmic artery in the orbit, and the terminal branch of the ophthalmic artery was following the route of the nasociliary nerve, and it exits from the same point where the nasociliary infratrochlear nerve was exiting. Here its name is a little different. Its name is dorsal nasal artery. Depending upon the area of its supply, it is supplying the dorsum of the nose. It may anastomose the facial artery. And then another branch of the anterior ophthalmic artery is this branch that is following the nerve of the same name, that is the external lateral artery branch of anterior ethmoidal artery, and it is exiting from the same point between the cartilage and the nasal bone above. Then we are left with this artery. This is the infraorbital artery branch coming from the same infraorbital foramen branch of the same maxillary artery, and it supplies the lateral aspect of the nose. So this is about the blood supply of the exterior of the nose. Let us talk about the nasal cavity.